Personalised care for people affected by cancer is part of the NHS long-term plan to enable everybody with a cancer diagnosis to have care that's personalised to them. We have a personalised care passport that we give to all of our patients that helps them navigate the different domains of personalised care. This booklet should be kept with that person throughout their treatment and afterwards, so it's a point of reference for them. In the booklet you'll see there's a chance to write down who the patient's clinical nurse specialist is and their contact number, and then some really important contact numbers as well that may help them whilst they're having treatment and afterwards. So, for example, the Cancer Navigator's telephone number, the Cancer Information Centre, the Emergency Assessment Bay. There's all sorts of information there. We've also got the Assessment Bay details, their telephone number, but also a description about what the Assessment Bay is and who it's for. We then go on to talk about holistic needs assessments, and what we mean by holistic needs assessment is that patients should be given a chance to talk to a healthcare professional about what's important to them at that point in time, and that might change at different points as the patient's having treatment and after treatment. So it's important those conversations are had on a regular basis. Ideally, holistic needs assessments need to start within 30 days of somebody having a cancer diagnosis. And it's a way of having a two-way conversation between the patient and the healthcare professional about what's important to them. So it could be that the main priority is finances. It could be for somebody else to get their pain under control. Everybody's needs will be different, and it's important that we understand each individual's personal needs. The second point of personalised care is care planning. So it's not just about finding out what's important to somebody, it's about the healthcare professional working with the patient to come up with a plan to enable them to meet their needs. So for the example of finances, if somebody expressed concerns over their finances, their care plan might involve a referral through to the Macmillan Welfare Rights team for an assessment. So care planning should be done together with the healthcare professional and patient. So the middle part of the booklet explains the cancer care team at Northampton General Hospital, and that's because a patient and their loved ones, family carers, are likely to meet a lot of people during their treatment and afterwards, and it just gives an explanation of the different people they may meet and what their role is. It then goes on to explain within the passport about the health and wellbeing that we offer. So here at Northampton General Hospital, the Macmillan Information and Support team provide health and wellbeing. There is a prospectus available for patients. It's a 6-monthly prospectus with dates in to enable somebody to choose what they want to do, when they want to do it, so they can plan around their treatment. Within the prospectus there is all sorts of offers, and it's in keeping with the good pillars of health. So there's workshops or classes to help somebody move more. We've got information support on eating well, long-term side effects. We've got information on the HOPE course that we run. So there's all sorts of health and wellbeing offers for patients and relatives to access. The last domain is on the next page, and it's the end of treatment summary. So after each cancer treatment, a patient will have a summary of the treatment that they've had, so that if they were asked by another healthcare professional about the type of treatment or the doses or whatever about that treatment. They've got it on this piece of paper. But it also as well tells patients about the long-term side effects that they may experience and who to contact if they have these long-term side effects. For a lot of people, they have a fear of recurrence. So within the treatment summary, it gives you an idea about checking yourself. So for example, for somebody who's had breast cancer treatment, then on the treatment summary, there'll be a guide on how to check breasts after cancer treatment is finished, and then more importantly, who to contact as well. And then the support that's offered once treatment finishes, which is really important. Quite often patients say that's when they need a lot of support, once the treatment's finished and they get back to some kind of normality. And then within the passport, we give an overview about what a cancer care review is. It is the responsibility of the GP to contact the patient and offer a cancer care review. This should be an appointment on its own. It shouldn't be part of an existing appointment, and the patient should know that they're having a cancer care review. And this really is a chance for the GP to talk to the patient about how they're feeling. Have they got any concerns? Is there any long-term side effects? And then to action anything from that, whether that be a referral back into the cancer services or signposting to professionals in the community. The passport then gives a chance for people to write in anything, any notes along the way, whether that's other contact numbers or just about their treatment. It can be anything. And then on the back, there's some useful links for any websites that are useful for patients and carers and family that they may want to access whilst they're having treatment or after.